Welcome to our detailed video discussing surgical options for treating fibroids, myomectomy and hysterectomy. In this video, we're going to explore these two options, talking about their benefits and potential risks. Hi, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. On this channel, we discuss health information to let you know more about your body, feel and live better. So I'd love you to give this video a like and consider subscribing to the channel. And as we celebrate Fibroid Awareness Month, I'd love to invite you to our stores to check out our health guides and trackers, particularly on fibroid symptoms and treatments, and you're going to get a special discount. So please head on over. The links will be in the description box for you. Now let's dive into today's topic. Surgical intervention or treatment may be recommended when non-surgical or medical treatments have not helped in relieving the symptoms of fibroids, or the fibroid symptoms are just so severe. Two common surgical options that we have today are myomectomy and hysterectomy. So let's begin by discussing a myomectomy. A myomectomy is a surgical procedure where the fibroids are removed from the womb. So the womb itself is preserved, it's not removed. It is typically performed for women who wish to retain their fertility or women who just want to keep their wombs. So now let's talk about the benefits and potential risks of having a myomectomy. First benefit, the womb is preserved when you have a myomectomy. Of course, this is important if you still want to have children in future, but there's some of us who just want to have our wombs in place. Next, fertility preservation. For women who want to have children, myomectomy can be an effective answer to having fibroids. This is because the presence of the fibroids could interfere with the ability to have children or even lead to miscarriage or trouble delivering the baby in future. And number three, relief of symptoms. Having a myomectomy can provide relief from many fibroid symptoms like irregular menstrual bleeding, painful sex, bloating and pressure just from taking the fibroid out of the womb. And what about the potential risks of myomectomy? Well, first, you have to think about surgical complications like bleeding or infections. Having a myomectomy can lead to significant loss of blood, meaning that you may need to have a blood transfusion. Number two, scar tissue formation. This can happen in any surgery, and following a myomectomy, it is possible that having scars could lead to future fertility issues or even problems like pelvic pain. Number three, fibroid recurring. Yes, it is possible that after having a myomectomy, the fibroids will come back. A myomectomy will remove the existing fibroids, but that doesn't mean that fibroids cannot still develop in the womb at a future date. Okay, so let's talk about the second surgical option for treating fibroids, that is a hysterectomy. A hysterectomy is a surgical procedure that involves the total removal of the womb. This procedure is considered definitive for fibroids treatment because it removes the chance of the fibroids ever coming back. But it is typically recommended for a woman who has finished having her children, or she just has very severe symptoms that have not responded to any other treatments. And so let's explore the benefits and potential risks that can be associated with a hysterectomy. The first benefit is that of total fibroid elimination. It's a permanent solution. There is no possibility of recurrence. Number two, relief from symptoms. Related to the first benefit, once the fibroids are removed, all the symptoms that are associated with fibroids also go away completely. Number three, having a hysterectomy can also be helpful in treating other related or associated conditions. These could include things like endometriosis or adenomyosis if they're also present. So all these can be taken care of at the same time as the fibroids when a hysterectomy is performed. What about the potential risks that you may have with a hysterectomy? Again, number one, surgical risks. It's a major surgical procedure, so think about risks from bleeding, infection as mentioned before with myomectomy, or complications associated with having anesthesia. Number two is the loss of fertility. The procedure results in permanent infertility since it involves the removal of the womb. So it is important, if a woman is still in her childbearing age, to consider this effect before choosing a hysterectomy. Number three, hormonal changes are another potential risk that could happen after a hysterectomy, because removing the womb can be associated with hormonal changes, especially if the womb is removed along with the ovaries, where many reproductive hormones are produced. This can result in symptoms of menopause developing in much younger women. So it's important to remember that the choice of surgical procedure depends on the individual, your fertility desires, how severe are your symptoms, even your overall health. Talking to a healthcare professional is essential to be able to decide which particular option will best suit you. Make sure you go and have a look at our shop, because on sale during this Fibroids Awareness Month is the Fibroid Treatment Decision tool that goes through all the different options for treating fibroids and helps you decide which option will best suit you. Thank you so much for joining me in this video. If you have any questions, you can use our email health information service. The link for that will be in the description box below. Please give this video a like and share it with a friend who you think might find it useful, and I will see you again soon.